So for restricted lateral rotation of his ilium, I'm going to use a technique that's similar to the posterior glide, but I'm going to cross my hands. This is on page B7 in your book. So ASIS, crossed arms, a little bit of squish or a little bit of feeling. And again, I could start with the super light version. I actually get a read on that right away. It was similar to what we're checking off camera, where from my side it feels like the left side's moving less.
The squeeze less for you?
Yeah.
It's funny, yeah. In my brain, I'm perceiving it on this side moving more. Like that doesn't feel like it really does anything in my internal sensation of it.
So now I'm going to use a little more pressure to see if I can get what he's feeling. Okay, yeah, actually, still there for you?
Yeah, I can feel the back of my ilia on the left side is coming to the table, and this side doesn't seem to respond.
You talked me into it, yeah, because I do feel that left side yielding and the right side not yielding as much. So the technique could be the same as the assessment, where I just lean into that right side, the less mobile side, and wait for it to change with that breath. Or I can combine it with the last technique, because in real life, that medial and lateral rotation of the ilia actually happen together. It's much more often that you're getting this kind of shift through the pelvis. In fact, every step and every time we drop our knees off to the side when we're laying on our back, our pelvis is doing that a little bit. So usually they're moving together contralaterally, as opposed to, it's rare that they actually do that unless you're giving birth, for example. Yeah, they actually spread apart or do that. That's probably giving birth also, maybe. But that's not as common as them moving in a contralateral way in those motions. So now that he's here on the back, I can actually essentially check that contralateral mobility on each side. Now I'm not actually going to rock his pelvis. I'm going to shift its shape by rocking in each direction. So that would be something like this. Again, ASIS. And we could start on the feather light direction just to feel for willingness to move more than trying to mobilize him. And I can imagine that that's harder. Yeah, you feel that too. That's pretty clear, even at that feather level. Now I could, especially if there was an injury or a lot of sensitivity, or in the acute situation someone asked about, I could wait right there at that feather level, just that lightweight level, and wait for the shift. Sometimes when the heavy work doesn't get the change we want, coming back out to the super light version helps the nervous system relax or shift into what we're asking of it. How's that going?
Good. It makes me really drop in to pay attention.
Effective enough? Satisfying enough?
Yeah, for now it's good. I get to process it.
Yeah.
I feel like I'd love more pressure, but at the same time I feel like I need it to figure it out.
Okay.
Yeah.
So is it the right amount for you? Or?
It's good, yeah, it's
okay.
good. Perfect.
Because I'm wanting to use more pressure too, but I think that's just me. Again, I think I just want to feel that thing squish in there. But I'll just wait right there, because it's more important that you're able to soften into that and allow it more than just be passively manipulated into that shape.
Makes me aware that I almost have an active recruitment to put me in the other way. And so this is like me, this helps me figure out what to let go of.
That's great. So Chris is obviously a body guy. He's teaching this work too, so he's able to articulate things in ways your client might not. But it's the same process. You wait, you ask your client their experience, you help them stay with their present moment experience and allow the movement in the direction you're asking it. Until there's a shift. And I'm going to, okay, if I ease on out of that?
Yeah, perfect.
Okay. So I showed you the cross hand, which is doing lateral rotation of the ilia, and then I showed you a combined left and right, which does both the medial and the lateral in the same technique. Any questions about that last bit?
Yeah. Where is the shift taking place?
In the last bit, where is the shift taking place? Because I'm moving the whole thing in that direction, it's SI joints.
Okay.
and pubis, but most of the ligament or the movement restriction is going to be at SI joint.
Okay. Now your hands. So I'm confused. You look like your hands are applying.
Do you want to hold the sacrum, Chris? Just the sacrum, if you can. Figure out a way to hold that. I was pushing one way, one the other.
Okay.
So this was checking for lateral rotation. This was checking for medial rotation, and I was feeling for which direction was stiffer.
Okay.
And holding in that direction.
That makes more sense.
Get some help during the practice, or, you know, if someone's watching the recording, they can write in for that kind of question. We can help with that too.